Hello, I'm Ohio Governor Mike DeWine. Welcome and thank you for joining us today for this important webinar. Ohio is on the road back. Thanks to vaccines and thanks to your efforts, we're getting back to the things we loved doing before the pandemic. Together from the very beginning, we have been committed and consistent about prioritizing older Ohioans in our fight against COVID-19. That has been apparent through your hard work in facilities and also throughout the state of Ohio. The vast COVID-19 testing program for long-term care facilities has helped us identify and prevent additional spread of the virus in our nursing homes. Ohio worked to get PPE to care facilities even when the nation faced great shortages. We also made nursing home and assisted living residents among the first in the state eligible for the vaccine. As vaccines became more widely available, we ensured that all older Ohioans had access in what we then called Phase 1B. Efforts continued through programs such as the senior housing vaccine clinics and homebound efforts. Ohio also moved quickly and was the first state in the country to put in place a vaccine maintenance program for our nursing homes and assisted living facilities to ensure that every single staff member and resident had an opportunity, a continuous opportunity, to get vaccinated. Throughout the last year, we have worked diligently to ensure health orders struck the important balance between protecting physical well-being and mental well-being. That balance has been center stage for many of the discussions and decisions made with medical experts. As the community spread finally started slowing down thanks to the wide availability of vaccines in Ohio, we updated those orders once again. Now is the time when we transition from orders to guidance. The orders outline what should be done, but now you know how to protect older Ohioans and how to incorporate those best practices into the daily operations of your facility. Ohio continues to make tremendous progress on our road back, but you must continue to be vigilant. Now, we are still seeing some outbreaks. They're certainly fewer than they were before, but they are occurring. And as our nursing homes, assisted living open up with increased interaction, and comes increased risk of additional infection. So please, please continue the safe and healthy protocols. Mask up in healthcare settings, mask up elsewhere. If you're unvaccinated, get vaccinated. Continue good cleaning practices and reduce the chances of illness by holding activities and visits outside whenever possible. We're trusting you to continue the important work of protecting those who have been most impacted by this virus. We're looking to you, the leaders of our nursing homes, our assisted living facilities, our adult care services, and senior centers, to help lead the way into the next phase of the pandemic. I know that the last 16 months has been very tough, and very tough for you. It's been a strain on resources and a strain on you emotionally. Thank you for your dedication. Thank you for your compassion. Thank you for making Ohio the best place to age in the nation. We are a better, stronger, healthier Ohio because of you.
Thank you, Governor DeWine, and thank you all for joining us today. My name is Ursel McElroy, and I am the Director of the Ohio Department of Aging. It has now been a year since the beginning of what is arguably the largest public health emergency most of us will experience in a lifetime. COVID-19 took aim at older adults, threatening their health, their needed services, their interactions with loved ones, and their lives. Throughout, you have been called upon to be brave, flexible, and resilient, among other things, and I thank you. While we are still in the midst of the pandemic, I am encouraged that we have opportunities like today to begin restoring the critical connections we all very much need. Ohio is on the road back, averaging less than 50 cases per 100,000 people. Effective June 2nd, Governor DeWine lifted the vast majority of public health orders and most recently on June 18th, the state of emergency was lifted. During this hour, we will address visitation, testing, CDC and CMS guidance, compliance, the Regional Rapid Response Assistance Program, and more. This time is dedicated to you, and we have a panel of experts available to address questions for you. During the session, lines will be muted, but feel free to use the question function. We will make every effort to post helpful information, tools, and resources to address any questions you might have today. I will be joined later by experts in post-acute and long-term care medicine, Doctors Coleman, Sobel, Howler, Jump, and Wigan. We also have our featured speakers today, Rebecca Sandholt, Chief of the Bureau of Survey and Certification for the Ohio Department of Health. Again, Dr. Wigan, who serves as our Chief Medical Officer of the Regional Rapid Response Assistance Program, or RAP, which you will hear more about later. I will also be joined by my colleague, Dr. Bruce Vanderhoff, Chief Medical Officer of the Ohio Department of Health. So we will begin discussing visitation. Since March 22nd, 2021, facilities have operated under the Director's 7th amended order to permit access to Ohio's nursing homes with exceptions. The order was aligned with CMS requirements. However, it was more prescriptive to support safe management of operations, capacity, and flow. Effective June 18th of 2021, that order was rescinded. State regulations on how those visits would occur have ended. For example, visits will no longer require reservations, and residents can have more than 2 visitors at a time. And although the order has been rescinded, it remains incumbent upon you as leaders to ensure sound clinical and safety practices, such as how to manage capacity and flow within the building. But I would also point you to CMS Memo QSO 2039NH, which was revised April 27th of 2021. Clearly states that visitation can be conducted through different means based on a facility structure and residents' needs. Some of those considerations would be location of visits, such as in resident rooms, dedicated visitation spaces, indoor, outdoor, and what visitation looks like for circumstances beyond compassionate care. But regardless of how visits are conducted, there are core principles and best practices that should be integrated in your operations to reduce the risk of COVID-19 transmission. These core principles: screen all who enter the facility for COVID-19, good hand hygiene, utilizing face coverings or masks appropriately, incorporating social distancing of at least 6 feet, posting instructional signage, cleaning and disinfecting high-touch surfaces, having appropriate staff usage of PPE, effectively cohorting residents, and then conducting resident and staff testing. And while we are excited about visitation, as always, we want to be certain that it is facilitated safely. And there are circumstances in which there are limitations. Visitation should be limited in certain scenarios due to the high risk of COVID-19 transmission. And this includes when you have unvaccinated residents, if the nursing home's COVID-19 county positivity rate is greater than 10%. And if less than 70% of residents in the facility are fully vaccinated. And you'll notice from the pie chart what our numbers look like as of June 10th. 871 facilities are in what we call green or low positivity of less than 5%. And we have 82 that are in what we call medium positivity, 5 to 10%. This underscores the need to always know your home's status with COVID-19 county positivity and vaccination coverage of residents. Next are residents with confirmed COVID-19 infection, whether vaccinated or unvaccinated, until they have met the criteria to discontinue transmission-based precautions and also residents in quarantine until they have met the criteria for release from quarantine. Visitation can also be limited when a new case of COVID-19 is identified. And once that new case has been identified, outbreak testing must commence immediately. If the first round of the outbreak testing reveals no evidence of additional COVID-19 cases within other parts of the facility, visitation can resume for residents in areas without COVID-19. But if the first round of outbreak testing reveals evidence of one or more additional cases in other areas of the facility, visitation should be suspended for all residents. As always, facilities should carefully consider all implications for resident physical and mental well-being when determining how to facilitate visitation. And according to the Centers for Disease and Control Prevention, or CDC, they have created guidance specifically for nursing homes. I'll point your attention to the interim infection prevention and control recommendations to prevent SARS-CoV-2 spread in nursing homes. This summarizes the core infection prevention and control practices for nursing homes during the pandemic. And some of the recommendations can be modified in response to the vaccination. And these modifications are regularly updated. And the second document, which is known as Updated Healthcare Infection Prevention and Control Recommendations in Response to COVID-19 Vaccination. In addition to staying current as the guidance evolves, it will also be important for you to develop visitation policies consistent with the evolving CDC and CMS guidance. You should also continue to educate residents and visitors about the risks of the spread of COVID-19 and the appropriate safety measures to take to protect themselves. You should also have a good testing strategy in place. And this brings me to the next topic of testing. I'll spend the next few minutes addressing the current CMS requirements, state requirements, and a new self-service tool to assist with ordering tests, reporting results, and requesting vaccine support. CMS Memo QSO 2038NH addresses testing in nursing homes during the public health emergency. Updated on April 27, 2021, the memo outlines 3 testing triggers and how each impacts staff and/or residents. The first is symptomatic testing, where staff and residents with signs or symptoms must be tested immediately. The second is outbreak testing, defined by CMS as a new COVID-19 infection in any staff member or resident within the nursing home. And upon identification of this single new case of COVID, it is expected that all staff and residents will be immediately tested, and they should be retested every 3 to 7 days until no new cases are identified for a period of at least 14 days. And then there's routine testing. And this is testing staff based on community spread, but it's not recommended for residents unless the resident leaves the facility routinely. Now, it's important to keep in mind that the CMS guidance represents the minimum testing expected. The table illustrates both CMS and ODH requirements. And this afternoon, you will hear more from our panel of medical experts about the importance of testing and why, if you notice from the chart, that we support a more frequent cadence at this time than the minimum requirements of CMS. The director's order for the testing of the residents and staff of all nursing homes was updated on May 4th of 2021, and it requires routine testing of all unvaccinated staff at least twice per week. Fully vaccinated staff do not have to be routinely tested, and regardless of vaccination status, staff and residents with symptoms or signs of COVID-19 shall be tested. Likewise, regardless of vaccination status, all staff and residents shall be tested upon identification of a single new case of COVID-19 infection in any staff or resident, and this begins the outbreak testing. And this is a good place to emphasize or to describe exactly what we mean by fully vaccinated. Fully vaccinated, for our purposes discussed today, refers to a person who is equal to or more than 2 weeks following receipt of the second dose in a 2-dose series, or a person who is equal to or more than 2 weeks following receipt of 1 dose of a single-dose vaccine. This is an important point to note, as some staff and residents may be at the midpoint of a 2-dose vaccine, in which case they would not be considered fully vaccinated yet. Now, state support will continue for testing efforts, and while state support has been and remains optional, adhering to the testing requirements set forth within the order and related guidelines are not. Currently, facilities receive some level of support to satisfy the testing requirements. There are considerable facilities that choose among the 4 options that we have. One option being alternating PCR and rapid antigen test. You receive a combination of both PCR and rapid antigen shipped to your facility. The second option is rapid antigen test only, and the third is PCR only, with the final for facilities who opt out of state support. I want to spend a few moments to talk with you about a COVID-19 care center that is scheduled to launch on June 28th. It has self-service functionality that can be easily accessed from our website and consolidated in one place for easy navigation of many functions that you currently use today. It requires one sign-on to access all the functionality. And those facilities with an existing vaccine maintenance login will be able to use that for all the self-service functionality. And for those without an existing login, you will be sent credentials and login instructions next week. Each facility receives one login so that several people in the facility can utilize the portal. Once authenticated, you can make selections to update your facility profile. You can manage your state-supported testing options. You can manage your vaccine maintenance program options. There are also indicators that will alert you to whether or not your profile has been updated within 30 days. And this is an opportunity to update any point of contact changes, staff and resident census, or other pertinent information. The indicators will also confirm if any required reporting has been submitted. And for a quick reference, the opt-in status for testing and the vaccine maintenance program are displayed along with the next vaccine clinic date you have scheduled. Also, with the testing program selections, you can make them at any time through the portal. The capabilities will include aligning testing selections on shared campus settings, selecting and where needed, changing the preferred testing dates, selecting and where needed, changing your program selection. For example, you may want to switch from antigen and PCR to antigen only. You'll also be able to select and where needed, change the lab that you are working with. You can also make selections for the vaccine maintenance program. And again, these can be made at any time through this portal. Once selections are made for either testing support or vaccine support, an email notification with selection details will be sent to the facility point of contact. And in the case of the maintenance program, the pharmacy also will receive notification. So again, after the webinars have completed this week, you will receive a welcome communication from the Department of Aging COVID team introducing you to the portal. You will also receive a user guide document, directions and instructions on how to validate your credentials, confirm the accuracy of your baseline profile, and how to contact us for assistance. And finally, just a note on the vaccine maintenance program. We have received considerable participation. As of today, 1,569 licensed facilities have opted into the program. And for the 177 that have opted out of the program, they have reported to us and indicated to us how they are receiving vaccine from an alternative source. So it's my pleasure to have with me today Dr. Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. Dr. Vanderhoff, you have been instrumental during this pandemic, coming aboard in the fall and serving as one of Governor DeWine's principal advisors on COVID-19. It has certainly been my pleasure to work alongside you, and I have simply been fascinated by your vast medical expertise and collaborative approach to getting things done. Now, when you arrived, we were bracing for an anticipated spike in COVID-19 cases. The vaccines were not yet available to us, and we entered December with the infections and deaths continuing to climb. Then, mid to late December, the vaccine arrived, and Governor DeWine made the critical decision to prioritize congregate settings, in particular, those settings that serve older Ohioans, such as our nursing homes, assisted living facilities, and soon after, Ohioans aged 65 and older. Most of us understood that if we were to have a chance to reduce the infection rates and deaths, we would have to work tirelessly to vaccinate residents of nursing homes, assisted living, participants of our adult day and senior centers, and older adults in affordable housing communities and other independent residential clusters. Our cases began to plummet, and the desire to relax visitation restrictions mounted. For some, nearly a year had passed without regular personal contact with loved ones. Recognizing the benefits, measures were put in place to balance the two safely: physical health and emotional well being. Now, while we appreciate that with every visitor and every worker, there is a risk of exposure, particularly from those who are unvaccinated. So, while cases and deaths have declined sharply this year, there is still a risk. So, please tell us, are we ready to take this risk?
Well, thank you so much, Director McElroy. There's no question that earlier this month, June of 2021, Ohio achieved a benchmark that we have been looking forward to for some months. We are now reporting fewer than 50 COVID cases per 100,000 residents, a place we haven't been since June of 2020. Reaching this benchmark really is a positive sign, a sign that Ohio continues to move forward into a new phase of the pandemic. We're seeing daily cases of COVID-19 fluctuate in the low hundreds, whereas we are seeing cases, nevertheless, that are reported in the thousands each day when we look back to the peak of the pandemic. So it's a big improvement. It's a really welcome improvement. And as you alluded, I think we can largely attribute these improved case rates to our vaccines. Quite simply, the COVID-19 vaccines are working, and they're working very well. And since vaccines became available for older Ohioans and are now widely available statewide, we are thankfully seeing fewer and fewer cases, fewer hospitalizations, fewer deaths, both in our nursing homes and in our other congregate living settings statewide. So one could really ask rightly, well, what about masks and other precautions? Can we be done with those? And my answer to that is that although the data really is promising, as I've described, everything's moving in the right direction. Nevertheless, older Ohioans, particularly those who are unvaccinated, remain very susceptible to severe complications if they become sick with COVID-19. And we know that people who are in congregate living settings, such as our nursing homes and assisted living facilities, and even our older Ohioans who are coming for care during the day in our adult day settings, that's our most vulnerable population in the state. And when we look at the virus, we have to recognize that COVID-19 isn't sitting still. On the heels of the B.1.1.7 variant that's now dominant in Ohio, we have another highly contagious variant, the so-called Delta variant, which is actually B1617.2, coming into the state. And reports from around the world suggest that this variant is making unvaccinated people sicker faster and is quickly replacing B117 wherever it arrives as the dominant strain. So continuing with COVID-19 precautions, especially in environments like nursing homes, assisted living, and adult day, will add another layer of protection to help keep more Ohioans, especially older Ohioans, healthy. Now, the case rate in the general population, as I've referenced, is decreasing, and we're very thankful that we have reached and stayed below 50 cases per 100,000 residents. But progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, is why we're all feeling safer. It's why we are able to take some very welcome steps back towards the life we know, life without masks. However, we still need to take certain precautions in the settings that I've described. Our case rate in the general population has clearly decreased, and we're very thankful for that. It's decreased and it's staying below 50 cases per 100,000, but progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, that progress, that's what's allowing us to feel safer as we take important steps back toward the life that we have known, life without masks. But we still need to take certain precautions in the settings that I've referenced, in our nursing homes, in our assisted living, and our adult day settings. These are the settings where the population that is at greatest risk from COVID-19, when we look back at the data both in Ohio and across the state, are being cared for. And masks have long been used with success now in not only these settings, but in healthcare settings. And during this pandemic, we have seen just how beneficial masks are in slowing the spread of the disease, particularly among the unvaccinated. Just look at flu and colds. How many people do you know who actually had a flu or a cold this past winter? Not only is it a good practice to wear a mask in a healthcare setting, it's also recommended by the CDC, and it's required by many hospitals and healthcare providers. Now, for those who are unvaccinated, I want to remind everyone that the threat of COVID-19 remains very, very real, especially now with the global rise of the so-called Delta variant. And so we really can't let our guard completely down. If you're not vaccinated against COVID-19, please continue to wear a mask in public. And Ohioans that are able to get vaccinated really should. The COVID-19 vaccines are safe and they are effective. They don't contain tracking chips. They don't change your DNA or impact your fertility or magnetize you. What they do is protect you and others from getting COVID-19. Now, staff and residents in our nursing homes, in our assisted living, in our adult day settings who haven't yet been vaccinated really should talk to their doctor to learn more about the COVID-19 vaccines. Congregate living environments are really special environments where we need to care for and do care for some of the people who are most vulnerable to COVID-19. So in these facilities, we need to be especially careful about creating a COVID safe environment. In addition to taking precautions like washing your hands and wearing a mask, you should take extra care to think about how you can help us limit the spread of COVID-19 in the care environment where you work. So, for example, should we be cohorting residents who are ill or test positive for COVID-19? Of course, we should. What else can we be doing in the environment where you work to keep the people you're caring for and working with safe from this virus? A virus which, as we look back over the pandemic, has taken a very severe toll, certainly on the population of Ohio as a whole, but especially on our older citizens. So remember the important role that all of us play in helping to decrease the risk of spread of this virus, a virus which we're beginning to win the battle against, but a virus which is certainly still with us and which we still need to think about as we get up each day to go into our workplaces and care for some of the most vulnerable Ohioans.
So, Dr. Vanderhoff, I do appreciate you walking us through that very important information. And I think what I find most fascinating is the importance of understanding the difference between some of the guidance that has come out for the general population and why we have to be especially vigilant within these congregate settings. Can you speak to that just again for a moment?
Absolutely. So when the CDC came out with its guidance regarding what we can do safely when we are vaccinated, it was really addressing how we live our lives in more public settings. And there's no question that when we are vaccinated, we are very safe in terms of our risk of getting COVID-19 and even of transmitting COVID-19 to other people generally. But we know from our experience throughout this pandemic that certain settings pose a much greater risk for the transmission of SARS-CoV-2, the virus that causes COVID-19, and for the population that either lives in that environment or is served in that environment. And of course, some of the environments where we have to be the most careful are those where we are caring for our older Ohioans, or our older Ohioans are residing, our nursing homes, our assisted living environments, and our adult day settings. Those are settings where the guidance, along with the guidance for healthcare coming from the CDC, continues to point to the importance of COVID safety measures, including masking. The mask remains a very effective measure for us to help decrease the risk of the spread of this virus. So thankfully, at this stage in the pandemic, we can feel really good about getting vaccinated and the safety that the vaccine provides us. But we have to remember that when we are in these environments where we are caring for vulnerable people, we have to take extra care and be extra careful. So one of the points I think it's important for us to remember is that the COVID-19 pandemic continues to evolve. It continues to change. And so therefore, the guidance, the healthcare guidance that we need to be mindful of will continue to evolve along with it. Our best guide for understanding what we need to do to keep each other safe is the CDC. And so I would encourage you, as this continues to move ahead, to look towards the guidance that the CDC provides regarding the environment in which you work, whether that's a nursing home, an assisted living facility, an adult day setting. The CDC will continue to be our best guide.
So, thank you for joining us today, Dr. Vanderhoff. We do appreciate your time and expertise.
Well, thank you very much, Director McElroy. I want to express my sincere appreciation and the Department of Health's appreciation for your leadership, as well as for all the wonderful work that so many Ohioans who are involved in every day in the care of older Ohioans have offered throughout this pandemic. Your hard work has really made a difference, and there's no question in my mind that the efforts of people in our nursing homes, our assisted living, and our adult day settings have made a difference in the health and the lives of Ohioans throughout this pandemic. So I'm very appreciative, as I know all the members of the Department of Health are, for the work of our Department of Aging and people in the elder sector.
I'm happy to be here and for this opportunity to provide information to our nursing home providers. With the state of Ohio opening back up, we must remain vigilant in our infection control practices. We should use reputable sources of information to continue to frame facility policies and procedures. Even with the state of Ohio public health orders being lifted, we must remember that the federal requirements related to COVID are still in place. This includes the quality, safety, and oversight memos released by CMS. There are a few that I would like to discuss with you all from a compliance and accountability standpoint. The first one being QSO 20-39, Nursing Home Visitation COVID-19. With the increase in vaccine availability, CMS, in conjunction with CDC, updated visitation guidance. This doesn't mean that there isn't still an emphasis on the importance of maintaining infection control practices. Facilities should allow indoor visitation at all times and for all residents, regardless of vaccination status, except for a few circumstances when visitation should be limited due to a high risk of COVID transmission. However, outdoor visitation can occur at any time. If a resident is fully vaccinated, they can choose to have close contact with their visitation while wearing a well-fitted mask. Remember, compassionate care visits should occur at all times, even for residents on transmission-based precautions. Surveyors will continue to look at visitation logs to ensure this memo is being followed. Federal and state surveyors are not required to be vaccinated and must be permitted entry into the facilities unless they exhibit signs or symptoms of COVID-19. Surveyors should also adhere to the core principles of COVID-19 infection prevention and adhere to any COVID-19 infection prevention and requirements. It's so important for our population within nursing homes to have a connection with their family and friends, and visitation is most definitely a way to do that. The next memo I would like to talk to you about is QSO 21-19. This is the newest QSO memo to come out in regards to the interim final rule COVID-19 vaccine immunization requirements for residents and staff. On May 11th, 2021, CMS published an interim final rule with comment period. This rule establishes long-term care facility vaccine immunization requirements for residents and staff. This includes new requirements for educating residents or resident representatives and staff regarding the benefits and potential side effects associated with the COVID-19 vaccine, as well as offering the vaccine to residents and staff. Furthermore, long-term care facilities must report COVID-19 vaccine and therapeutic treatments information to the Centers for Disease Control and Prevention, the National Healthcare Safety Network, NHSN. From a survey perspective, the infection control pathway that includes the information surveyors will be reviewing to determine compliance with this new tag will be posted to CMS's website, most likely after June 18th. educating residents and staff on the benefits of risk and potential side effects associated with the vaccine, offering the COVID vaccine to residents and staff as appropriate and when available, and reporting the COVID-19 vaccine status of residents and staff to NHSN will be some of the things that the surveyors could be looking for. Remember, documentation is key, showing that educational materials were provided, that there were sign-in sheets if you had a large staff presentation. Medical records show education was provided, vaccination status or refusal of the vaccine are well documented on both the staff as well as your residents. The next QSO memo that I would like to speak to you about is QSO 20-29. This is the interim final rule updating requirements for notification of confirmed and suspected COVID-19 cases among residents and staff in nursing homes. CMS is requiring nursing homes to report COVID-19 facility data to CDC and to residents, their representatives, and families of the residents. Two key components: reporting to CDC and the reporting to residents, their representatives, and families. The focused infection control survey is still in place. We are able to do a standalone as part of the annual survey. So we will be looking to see if that notification to family as well as the residents has occurred. Additional information related to the notification to CDC and families residents have been incorporated into this focused infection control survey, along with the requirements around the education and offering of vaccines. As I said at the beginning, these are just a few of the memos I wanted to highlight, but all are equally important. Please go to CMS's website, review the QSO memos, and make sure that you're implementing the requirements that are there, as well as the recommendations. I would like to note that we are seeing a slight increase in our focused infection control surveys. We are provided those surveys from CMS that we need to do. That's why it's so important to remember to get back to the basics, remind staff of proper hand hygiene, the importance of social distancing and wearing proper PPE when needed. Remind staff, even if COVID-19 isn't in the building, they need to be diligent on the donning and doffing of PPE. Surveyors will be looking for these things. I'd also like to remind everyone that the enhanced enforcement for any F880 citations, whether it's on a focused infection control survey or from an annual survey, will still require a directed plan of correction. Those have not been lifted from CMS, and we are not expecting those to be lifted anytime soon. Thank you for the opportunity to speak today to all of you regarding nursing home compliance and accountability. We are always available for assistance or questions if you have them. Thank you.
It's a privilege to address you, the staff, who are committed to the seniors who depend on Ohio's nursing facilities. As a physician who has cared for patients just like those who have benefited from the services you provide, I cannot put into words the appreciation I have for what you do every day. It has been an extraordinary 15 months since the beginning of the COVID-19 pandemic. I have personally experienced the loss of patients I have cared for years. I've seen staff members who became ill with COVID and reached out to me for advice and medication. I've had family members who worried that I might bring the virus home to them. I've worn the masks and face shields and gowns and used hand sanitizer. I performed nasal swabs on other people and myself for over a year. So now that we're passing into this next phase of the pandemic, I'm excited about the prospects of returning to a life that is similar to what I remember prior to March 10th, 2020. I understand that it can be similar, it will be similar, but it won't be the same. So yesterday I went to the grocery store and I actually could have bought as much toilet paper as I would have wanted to have. I saw Clorox and Purell on the shelves. I can now visit my 85-year-old in-laws because we're all vaccinated. I can go to church or a concert or a Cleveland Indians game. Over the past year, I've learned so much about appreciating little things in life and the relationships that went away during the height of the pandemic. There are other things that I've learned this past year. I've learned that everybody deserves grace, understanding, and patience. And make no mistake, the pandemic has affected all of us in ways that we may not realize. I've learned that over the course of the day, when I ask people how they're doing, and they pause and they look out kind of at the horizon and respond, "Oh, I'm fine," that fine means feelings inside not expressed. So we're now entering this new phase of the COVID-19 pandemic. And in fact, I've heard people say over this past weekend that they thought the pandemic was over. There are very few statements that I can say with certainty as a physician, and one of them is that the pandemic is not over. COVID is still in our communities. It still is among us. And until the entire world can have the opportunity to be vaccinated, like we have here in Ohio, the pandemic will continue to be a threat. Over the next days and weeks, it will seem like that threat has passed. We are unwinding the requirements and policies that the nursing facilities have been living with over the past 12 plus months. We will eventually be told that this is no longer an emergency. Nonetheless, the same virus that has disproportionately taken a toll on you, your peers, and the population we care for remains in our communities and among us. So we now have at our disposal an abundance of safe and extremely effective vaccines. And if widely accepted globally, this would end the pandemic. In the meantime, the virus continues to make millions and billions of little virus babies, and every once in a while, one of those babies is not quite so perfect. It's just a little different than its parent. It's a variant. Eventually, one of these variants will be just different enough that the vaccines will not be as effective. And we could slip back into the outbreaks like we experienced last fall. We can prevent this from happening through vaccination and continuing to practice all the tried and true methods of infection prevention, like hand washing and hygiene, wearing masks, especially around the vulnerable population, including the unvaccinated, and cleaning up after ourselves through sanitization of hard surfaces. Each of you will need to decide to continue these practices through the remainder of the pandemic, even if the Ohio Department of Health or Governor DeWine or the Ohio legislature rescinds the mandate to do so. Testing and infection prevention and control needs to be a part of what we continue to do every day for the rest of the pandemic, even if we're told that we don't have to. This now becomes our responsibility. It's kind of like school. We have made it through the elementary school portion of the pandemic where everything is laid out for us and we just have to follow the directions. We're now entering the entering college, where we get to choose what classes we take and what path we follow. The Regional Rapid Response Assistance Program, or RAP program, for which I serve as the Chief Medical Officer, stands ready to support you and your organization over these next important months. The state of Ohio will continue to provide testing supplies like rapid antigen tests, PCR testing, and vaccinations against COVID-19. If you go back to the metaphor about us entering the college phase of the pandemic, think of the RAP program as that guidance counselor that was always there to get you through your schooling. The program is supported through the Department of Aging with money allocated to fight the pandemic. We have 8 regional medical directors, some of whom will be answering your questions in just a few minutes. These medical directors want to help you and your team, including your medical director, when questions arise about testing or management of COVID outbreaks or just COVID in general. We have contracted with an organization of content experts in infection prevention who is available to you and your organization for COVID prevention and control, for testing strategies, and to provide another voice to educate about the value and importance of vaccination acceptance. In medicine, we call this a curbside consult or a second opinion, and this is available to your organization at no cost to you. RAP has a call center that is open and available Monday through Friday from 7 a.m. until 7 p.m. Please reach out to RAP for assistance. We also have been making outreach calls to facilities who are identified by the Ohio Department of Health as having experienced COVID outbreaks to introduce the program and to verify the accuracy of that information provided by the Ohio Department of Health, by local health departments. If you get a call from the RAP program, please accept it so that we can provide this valuable service and support you. The most important aspect of RAP is that it is at no cost to you, and it can save you time, let you continue to concentrate on the services that you want to provide, and very likely the RAP program could decrease illness and loss of life in the coming months. Thank you. It's great having this panel before you. I'm going to go ahead and have them introduce themselves, and also I'm going to ask them to think about a question, to kind of warm us up on the questions and answers. But if you can all kind of think about this question and respond to it in kind of the way that you feel like is most appropriate. So as we enter this new phase of the pandemic, what do you think are the opportunities and risks for nursing facilities over the next several months as the recommendations are slowly being peeled away? And why don't we start with Dr. Coleman. Dr. Coleman, thanks so much for being with us today. Once again, can you introduce yourself and give us an idea of what your thoughts are about the opportunities and risks?
Good afternoon. Thanks for allowing me to speak with you. And let me start by sharing my appreciation for everything everyone has done during the pandemic. I hope that the word appreciation never loses its value, because I know we throw it a lot, especially the last year and a half, but it nevertheless remains just as true as it did when the pandemic first started. So my deep thanks to all of you. I'm a geriatrician in the Beechwood area up near Cleveland, and I have gone through the pandemic with the rest of you and with some of you who are on this call today. In speaking about the opportunities and the risks moving forward, the opportunities are certainly clear, and they're what we've all been so excited about. There are opportunities to engage with the community in our facilities and the outside world again. There are opportunities for family visits and birthday parties and religious ceremonies and outings and music. There are opportunities to feel normal. Whatever normal is going to be, whatever we talk about, the new normal, it's better than what's come before, and it's very exciting. What are the risks? The risks, of course, are COVID. COVID's going to be a part of our vernacular moving forward. But the positive of that risk, and the risk being COVID and variants, the positive side is that we now know how to put into place infection control measures. We're experts now. We're experts at something we never wanted to be experts at before, except for Dr. Jump, who went to school to be an expert in this. The rest of us thought, let the specialists deal with it. But in that, we become specialists ourselves. We know how to do it. We're tired of doing it, but we know how to do it. And for that reason, we need to continue to do it so that we can continue to do more of those fun things. We can go to more birthday parties, and we can have more birthday parties at our facility so that we can share in these special events together. Continue to practice those core principles of infection prevention. I know I've screenshotted that little tidbit at the beginning of the Visitation QSO, and I share that like it's candy at Halloween, and I encourage you to continue to do the same. We need to continue hand hygiene. We need to continue to wear our masks. We need to continue to test. That's our best defense in this. Right now, the only, one of the more active things we can do is to continue to test. Most importantly, we can get vaccinated, and we can encourage those around us to get vaccinated. So, in summary, the big opportunity is to be human again and to share in common human experiences. And the big risk remains COVID, but we know what to do. We know how to build that gate. So let's continue to enforce it and keep it strong.
Great. Thanks so much, Dr. Coleman. Welcome, Dr. Haller. I know we've had some little technical glitches here, but you're here. Hopefully we can hear you. Can you go ahead and introduce yourself? And thanks so much for all the work that you've done as being really a very huge help to me through the WRAP program. Can you also kind of respond to the question that I posed about the opportunities and risks for nursing facilities?
So I'm Dr. Marla Haller, as Dr. Wagon said, and thank you so much for allowing me to be part of this and part of the WRAP program. Director McElroy, thank you so much for your support and your vision. I practice in Southern Ohio and am responsible for several long-term care facilities there. And it is truly a privilege to be able to serve all the Ohioans. COVID has been very, very challenging. I even have to liken it, like John said, to the frustration at times with technology. We think that we've become adept to, but we know what we know, and we don't know what we don't know, and life can be challenging. And so we're still in that phase of learning about COVID. And, just like Dr. Coleman said, I didn't get to hear everything that she said in trying to reconnect, but I do know that we do need to be diligent. We just need a lot of common sense being put forth. And, one of the focuses that I've really focused recently on, which has become a vital topic, is about the vaccines. And in regards to the rapid response team, we have been reaching out to facilities, and we have learned that if the facilities have a less than 45% staff that has been fully vaccinated, that we are seeing more outbreaks with regards to COVID. And so, COVID doesn't matter whether or not at this point in time you're vaccinated or not vaccinated, and maybe Dr. Jump will mention this, but we do know that if you are vaccinated, that you have a less likelihood of the severity of illness, and so you have less symptomatology, sometimes no symptoms at all, and so that is really important with regards to focusing on the importance of vaccines. The good news is that, we are hopefully winding down, but we all know that there are certain variants out there, and and some of the other physicians on this panel may also talk about the variants. But just remember that COVID-19 is still very real. We still need to be diligent. We still need common sense practices, like Dr. Coleman said, hand hygiene, really appropriate social distancing, when we are apprehensive as to the crowds that we are in. And so with regards to the nursing facilities, we just need to be diligent with everything that we are doing and we know how to do, because we are all very, very knowledgeable in regards to the care of all the residents that reside there. So I've probably rambled just a little bit, but please, I just have to encourage everyone, if you're not vaccinated, if your staff doesn't have the background and they need more education, reach out to the RAP program. I mean, all of us have been involved in education. We can send you literature. There is a ton of literature on not only CMS's websites, but on the CDC. You all have that at your fingertips, and we are happy to help in any way.
Thanks, Dr. Haller. Dr. Sobel, we'll go ahead and swing over to you. Thank you also. Dr. Sobel's been very instrumental in the monoclonal antibody initiatives throughout the state. And so I've appreciated that. And we'll probably talk about some other projects that he's spearheading as well. So Dr. Sobel, can you introduce yourself?
Sure. Well, first, let me thank Director McElroy and the Ohio Department of Aging for arranging this opportunity. I think it's extraordinary that we get the opportunity to share with each other. And as a geriatrician working throughout the state of Ohio, I've really had the opportunity to see how much collaboration there has been. Since the pandemic started, we went from very minimal knowledge to collaborating together, to sharing our expertise and developing good principles for how to manage through this pandemic. I would like to advocate for ongoing weekly staff testing. I think this is really a very important need. And it's a need until we get COVID-19 under control and get the many lethal variants totally out of the picture. If we don't test, it's impossible to know and identify who's asymptomatic and at risk for spreading the virus. I think we can all acknowledge, and my biggest fear is fatigue. Fatigue of testing, fatigue of doing all the precautions associated with managing through the pandemic. At the same time, one of the most valuable lessons that we've learned is that we need to know who is carrying the virus. Another important lesson learned is that asymptomatic individuals have just as much potential to spread the virus unintentionally as those with known infection. So identifying the possibly asymptomatic spread just as quickly as possible before an outbreak gets started requires ongoing weekly testing. We know in Ohio, our largest outbreaks in facilities occurred during periods when we relaxed the testing and we went to every other week testing. In order to protect our frail residents, as well as our own families, we need to know who is carrying the virus. Ongoing weekly testing is really the most effective method for maintaining protection. So I'd like to thank you for your consideration of continuing weekly testing. Thanks, John.
Yeah, and as always, we'll leave Dr. Jump to the end. We really appreciate you being here and your perspective as an infectious disease specialist. And of course, you have the unenviable task of getting to answer this question after 3 previous responses. So good luck with that.
Thanks again for having me as being part of this strong presentation. I'm an ID physician at the VA in Cleveland, and I focus on long-term care. So I'm nursing home savvy, though not the experts that most of the folks on this call are. And I've been involved with trying to help anticipate and help direct some policy for the pandemic since the beginning. So it's great that we're talking about unwinding at this point. I mean, this is This is the miracle that we've been hoping for over the last year, and we're there. And vaccines are what got us there. So one of the things that I think that hasn't been touched on yet is the opportunity for helping us understand what's happening with the variant strains across Ohio. So for the nursing homes that are having outbreaks, and it still happens, unfortunately, when that happens, especially with a vaccinated individual, if you can work with the R3AP program and or the Department of Health and get that swab or that sample sequenced, then we can actually get a handle on what's happening with the variant strains in our state as well as across the country. And this is becoming very important because where we're seeing spread now is places that are under-vaccinated, and we're seeing these new variant strains that are more readily spread and cause more severe illness become the predominant strains. So I mentioned that I'm nursing home savvy, but I also take care of patients across the spectrum of healthcare. So I do outpatient, inpatient, including intensive care when I need to as an ID consultant, as well as long-term care. And I was on service just a couple weeks ago, and I had 3 COVID patients. One was a 60-some-odd-year-old gentleman that had a renal transplant. So he was profoundly immunosuppressed because of the medications he has to take to keep his kidneys. He was vaccinated against COVID in January, so early on, and wound up more recently developing a COVID infection. And he was admitted more as a precaution than anything else. And he left the next day, overnight hospitalization, no need for steroids or no need for additional steroids, no oxygen, no monoclonal antibodies. He did fine. He went home and we were all quite relieved. And I attribute that success to the vaccine that he had received. Similarly, we had a 90-ish-year-old man that came in, also vaccinated, also had a breakthrough infection of COVID. He went home 2 days later. He needed some fluid support. We didn't do monoclonal antibodies. He did not need oxygen. He did not need steroids. He needed what amounted to chicken soup and a couple warm blankets and a little bit of TLC, and he got home. And that was fantastic. And then I was also managing over the phone one of our veteran patients who is a 45-year-old or so man with no chronic health conditions, but who did not get vaccinated. And he and his wife were hospitalized with COVID, and he was in the hospital for a week, and he went home on oxygen. His wife is not doing all that well at this point, and it just having these 3 cases in conjunction just showed me in a very stark way the power behind these vaccines to keep us safe and it seems to be working against all of the strains, not just the wild type that we faced when the vaccines were developed, but also against these new variants, including the Delta variant and the other variants that are of concern at this point. I'll stop there. Thank you.
Thank you, Dr. Jump. Director McElroy, do you want to go ahead and help us with some of the questions that are being asked?
Absolutely. And again, I would encourage you, if you have questions, please send them in and we'll do our best to get through as many today. And those we don't get through, we'll try to post information at a later time. So one of the questions is, staff who have had COVID and recovered are told they have antibodies. We have to treat them as unvaccinated. They feel that they should be considered vaccinated. Can you speak to why we are not able to treat recovered COVID staff members as vaccinated?
Well, at risk of going right back to Dr. Jump, I'll do that.
Okay, so the bottom line is that when someone has had a COVID infection, yes, you do get antibodies. We do not know how long they last, and we also don't know how broad they are. One of the things about coronaviruses is that when they cause infection, sometimes people get a mild infection, and with that, their antibodies fade away pretty quickly. Some people get a really severe infection, and we think that when that happens, their antibodies stick around, but we don't know yet because COVID is still a new virus. What we do know is that when people get the vaccine, they stay protected. At this point, we know for at least 8 months. That's from studies based on Moderna, which is an mRNA vaccine. And I have no reason to believe that wouldn't be true for Pfizer or for the Janssen vaccine either, for the Johnson & Johnson vaccines. So the other thing the other benefit that we get from being vaccinated, even if you've already had COVID, is that it seems to help expand the immune response a little bit, so we get more effective protection against the variants. And that's really a good thing to have. So it's like added benefit. And I would encourage everyone who's had COVID, if you haven't been vaccinated, please go ahead and get vaccinated. It's important. Thanks.
Okay, next question. I don't know if this one may be for perhaps Rebecca or it says, it was mentioned earlier that all positive cases must be reported to CDC. Is this the NHSN reporting or is this a separate report?
No, that's the NHSN reporting.
Okay, to make sure we offer clarity for the individual. Next question is, if a person tests positive on a molecular antigen test and negative on a PCR test in the same day, which test is correct?
I'll let the panel think about that question, and I'll look to Dr. Sobel to offer an answer. You want to repeat it? Just I can think of it. So
I think I got it.
And a rapid antigen test done on the same day are
As the PCR.
Negative.
So the rapid antigen test is very good at picking up and very broad at picking up the virus or fragments of the virus. It's like throwing a big net out there, trying to pick up any types of fragments out there. The PCR is much more narrow and limited and directed towards the coronavirus itself. And so that's why the rapid test is very good at screening. We get it very quickly. The PCR takes a little bit more time to get it, but the PCR is more specific about having the coronavirus itself. And that's basically the short answer to that broad question.
Right. And you know, this has come up a couple times actually in some of our calls that we've done through the outreach through the RAP program, where facilities have done screening using a rapid antigen test, and then because the person was asymptomatic, went ahead and did the right thing and did a PCR test, and then 2 days later that PCR test came back negative. And by definition, that's a negative test. Right. Now, some facilities have it in their policy to repeat that PCR test, and they'll do it again. And if that comes back negative, then boy, it really shows that it's negative. But I've talked to a couple facilities that said, yeah, but it came back positive. So that really throws us off. And although it's a little bit more complex, understand that the PCR test is an amplified test, and they go through a number of amplifications called cycles. And the more it has to go up, sometimes up into the 30s, it can be so borderline that it will be negative one time and then positive the next time. And we've actually reached out, part of the RAP program. The benefit is we can sometimes get through to the lab specialists at ODH and elsewhere in Ohio, and we posed that question, and they said, if you get a negative test with the PCR test after a positive rapid antigen test, that's a negative, and don't do a second one. So that was something that we ended up having come up within the last several weeks. I don't know if anybody else, Dr. Jump, I know you're pretty knowledgeable about that, or if that seems to cover that topic.
Yes, the only caveat I would add is that we have to, when we're talking about a negative a borderline negative PCR test, we have to consider that in the context of someone who's previously had COVID. If it comes up as a new test for the first time, we have to think about it a little bit differently sometimes.
Okay, so there's a request for any tips on monitoring for social distancing during in-room visits with unvaccinated residents or visitors.
Dr. Haller, you want to go ahead and try that one?
Sure. So I am presuming that the unvaccinated visitor is with a vaccinated resident. Certainly, if the resident is vaccinated and the visitor is unvaccinated, or if they're both unvaccinated, masking, we know that in the CMS recommendations that if you are unvaccinated, that you are still to be wearing a mask and you are still recommended to social distance. So I think each facility will have to figure out, as far as being able to police their own facilities and their own rooms. I mean, you know, the CMS and the CDC give guidance as far as policies within their own facility. I think they're going to have to come up with that and determine that. In a lot of facilities that I'm still involved with, they are still escorting individuals. Actually, some of the facilities that I'm still involved with, you know, everybody is still wearing a mask, unvaccinated or not, or vaccinated. So we are still wearing shields in some of our facilities with our masks as well, with regards to healthcare, the nursing staff and healthcare workers. You know, so, you know, protection is protection. So even if you wear more protection, you're still going to be very emphatic about infection control practices and risk reduction with regards to the spread of COVID, in case those unvaccinated individuals are positive for COVID and they're asymptomatic and they could still spread COVID-19.
If I could tack on to that at the end a little bit too, is just to underline the importance of family education. You know, a lot of folks are just so excited to be in the room that by no nefarious intent of their own, they just forget or they pop it under their chin. So doing a lot of gentle redirection when they're in the facility, but beforehand doing frequent communications with families about the difference in the CDC recommendations for the general public versus the nursing home, the difference in state encouragements for the nursing home versus the general public, and really reminding people that this is indeed a healthcare facility. While it's first and foremost somebody's home, we do provide a lot of medical care, and for those reasons, we need to be more strict in the masking requirements that we have. And I think sometimes by doing the education up front and setting expectations, having less surprises during that one-on-one visit can lead to better conversations.
I also see this as another opportunity to mention testing, because we certainly can encourage our families and to go ahead and get testing. Testing is now readily available, and it certainly can help, you know, to decrease that risk of spreading asymptomatic.
Okay, so what are some of the best practices for large group activities and eating and drinking at activities?
Dr. Coleman, you want to talk about activities?
Anytime we talk about activities or visitation, I take the conversation back to those basic core principles of infection prevention. Disinfecting surfaces, mask wearing, and social distancing. So obviously, if we're eating or drinking during an activity, it's going to be very important to continue social distancing. Some facilities have cohorted residents, so by vaccination status. Now, this can be more difficult if you have a smaller facility and maybe only one or two folks are unvaccinated and you don't want to exclude them. That's where you really focus on those other measures of the infection control practices. I think this is a good time to talk about memory care units, where it's even more difficult to cohort residents, especially with staffing shortages. So that's where you have the whole list of infection control practices. The goal is to put each and every one of those into place every single time. Now, if you can't because of certain social factors like memory care issues, or you can't because of numbers, then you can work backwards. But in doing that, you strengthen the other practices that you put in place. You strengthen social distancing, you strengthen your hand hygiene program, you strengthen your disinfection program, you strengthen things like physical barriers.
Okay, are there any other comments or?
Yeah, I guess I would just throw in a plug. The RAP program does have this group of infection preventionists that are available by consultation, and really, as you are seeking to expand services, and we all know how challenging this has been through social isolation, and really activities really serve as a kind of that road back. You can reach out to the call center at the RAP program and request just a consultation. And it's not that they're necessarily going to come to your facility, but they can discuss those with your nursing staff or your infection preventionist, just almost like a tutor, if you want to go back to the analogy of college. Just oftentimes the person who's being tutored knows the answer, and I do think that a number of our facilities have extremely talented infection preventionists and DONs and nurses who understand that. But sometimes getting that verification from a third party can be invaluable, and can allow you to expand those things like activity.
Dr. McElroy, if I can just add one thing, as Dr. Wygant mentioned, the RAP team and all of the wonderful things that that team can provide to you, I just want to let everyone know that facilities reach out to them. They do not tell us for survey purposes who those individuals are. It's very much a siloed approach for them. I know there was some concern with some of our assisted livings that maybe it was looked at as punitive. And I just want to encourage everyone on this call, take advantage of the expertise that has been put together under Director McElroy's leadership. If you have issues with vaccine hesitancy among your staff and your residents, reach out. If you have questions on infection control, reach out. I would love to not have to cite a facility for those things. So the more you can do to help and get those things in place, I encourage you all to reach out to him.
Thank you, Rebecca. Thank you. So the next question is, after 8 months, then what? Will vaccine boosters be ready?
Well, Dr. Jump, if you're in the studies, you probably have more eyes on that than most of us do.
So there are plans for clinical trials to start looking at boosters for some of the vaccines. To my knowledge, they're not underway yet, like actually enrolling patients getting needles in arms, but we're on our way. And I'll be among them, and I'll let you know how it goes. So we've only had the vaccines available for public consumption since like December. And what we know so far is that, as I said, 8 months, we still have good rip-roaring immunity. And we're going to all find out together how long this lasts. Typically, when we have a vaccine, it lasts for several years. For right now, it might mean that for COVID, with it being a pandemic, we may wind up doing boosters for the next year or 2 or 3. I don't know, but we're all going to find this out together. Some of the questions I've used to get are about, well, what about influenza? We have to get an influenza vaccine every year. It's not because your immunity wanes to the vaccine so much, is that the influenza strain changes on a regular basis. So that's why we have to get a new vaccine every year, because there's so much shift. COVID, we're seeing some change in that we're seeing the variants, but we're also seeing clinically in the real world that the vaccines that we have right now are working. As we get those boosters available, I think we'll see some expansion of the coverage to address some of the new strains as well. Thanks.
Okay, looks like there's a question. It says, in regards to the visitation changes, it is our understanding that we shall still screen visitors, but they do not need to be escorted to their loved one's room. Our concern is the stops they take along the way, speaking to other residents. Is this to be expected, or are we to intervene? We do not have all private rooms. Do we still use dedicated visitation rooms? And so I don't know if you want to weigh in on this, Rebecca. I want to make a comment that I'd certainly love to hear from you and then from others. One of the things that I mentioned earlier was around the CMS memo, the memo that was updated on April 27th, specifically QSO 2039. And it emphasizes that visitation can be conducted through different means, and it is based on a facility structure and residents' needs. Earlier, we had the 7th amended order that provided in a very prescriptive way of some ways that you could achieve this, ways that you could safely manage your capacity, your flow, and to help with operations. I think what you're hearing us say now, and what I think Dr. Wigan pointed to earlier, is we've moved from maybe our elementary grades into our college years, and that is now you have to look at your physical layout, your staffing structure, and see how you can do it safely, but at the same time balancing the ability for families and loved ones to come in and visit in the least restrictive manner possible, in the safest way possible. And I don't know if you want to add something to that, Rebecca, because at this point, with our orders off, we no longer as a state are saying that you must escort, you must have certain entry, number of entry points, that you must have only so many hours or a minimum time frame, or that you can only have so many visitors at a particular age. Those very prescriptive things are no longer in place. However, it is still expected and incumbent upon you to still manage the capacity and the flow in a way that still allows safe operations and in a way that mitigates the potential for transmission of the virus.
Yes, thank you, Director. So I think it's very important for us to remember that within the QSO memo that the Director has been referenced 2039, there are still the core principles of COVID-19 infection prevention. And within those, it identifies, the screening of all who enter the facility, that hand hygiene, that face covering in accordance with the CDC guidance, having instructional signage. So maybe you're not escorting someone, but you've got signage along the way that shows people where they need to go if you have a designated space. That you have specified entries and exits and routes to the designated areas and cleaning. So while the order was very specific on what needed to be done, the memo has the same information and the same requirements, but now it's within the facility's policies and procedures to have that outlined.
Thank you, Rebecca. So I think we're at time, and Dr. Wigan, I don't know if you or any other panelists, if this is an opportunity to say any final words about WRAP. I know there were a lot of questions here. We tried to get through as many as possible, but we will still post information as well. If there's anything you would like to share about WRAP before we conclude.
Yeah, one thing that I think is important that we did not mention is through the portal that's been created under the points of contact there's a new opportunity for you to put the medical director of your facility in. And one of the things that we've thought about through the WRAP program and through the clinical advisory group is, that provides us a great opportunity to be able to reach out to medical directors when new information comes forward, and to be collegial and close the loop on some of those things. So if you can, and I think that's a new field, if you can fill that out, it will automatically upload, and we'll be able to view those medical directors. And I think that'll be an important step for the WRAP program to help out. And I'll open it up to any other panelists to close.
Just a big thank you to the Department of Aging for allowing us to make this presentation and conveying as much information as we can.
I think with that, I think we are at time. We want to thank all of our panelists, our speakers. They've been great to spend time with us today and share their expertise. And I want to thank you for participating. We know you've had a lot placed on your shoulders, and you've just continued to persevere. And so as we pivot to this next phase of the pandemic, we certainly want you to know that we stand ready to be supportive of you, your residents, and your families. And with that, thank you. And we'll be in touch soon.